experienced, and I'm experienced by age, nurses that are looking for different opportunities. As some of these RNs and nurses get along in their careers, they're looking for something different to do. That maybe they're looking for options, and this is a great opportunity for them as well. So even for retiring nurses that want to do something different, this is a great facility to them. Nurses who became handicapped, maybe have a bad back or whatever, so looking for options to still use the skills that they have. So that's the kind of professionals we'll be using within that facility.
Member for Glace Bay.
Thank you, Mr. Chair. I know my time is just about to run out, so I'm.
We have approximately 1 minute and 15
Well, I'll take that time, Mr. Chair. Thank you very much. Just a reminder to the minister that when we're talking about such a system and who's going to staff it in terms of professionals, whatever the case may be, I'm hoping the minister just isn't relying on perhaps some retired nurses will be there. Maybe they will, maybe they won't. I hope there's more of a plan in place than to provide for staffing levels of such a system. It's the same as when the minister made reference to having a website for wait times. It's great to have the website, but the website simply provides you with how long the wait times are and how many people are waiting. The actual website doesn't do anything to remedy the situation of wait times in Nova Scotia. With that, Mr. Chair, I'll take my place and allow for the next speaker.
Thank you. Chair now recognizes the honourable member for Sackville-Cobequid.
One over. Just get the move. Oh yeah, no, definitely. He wants to take a break. I can.
Okay, we'll take a recess, short recess. Thank you. One seat. So you're sitting in the Dartmouth South, Portland Valley. Okay.
Call the committee to order, please. The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I want to thank the members for their indulgence, and I look forward to the questions from the official opposition.
The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chair, and I want to first begin by welcoming the Minister of Health to his hour 3, I guess, to his first set of estimates as Minister. I don't know if after the 10 or 12 hours of health estimates it was what he expected, but I'm sure when the Minister or the Premier asked him to take over health, or was told to take over health, he knew that this was going to be part of it. What I'll do, Mr. Chair, to the Minister of Health is actually just go a quick overview of some of the things I'm going to talk about and question him on, and then actually go into detail. So I'd appreciate him not answering everything I was going to talk about, but I'll get into questions, and I just wanted to give him a bit of overview of some of the concerns I have as the as the critic for health, the critic for health for our caucus, and some of the problems and issues that myself as the member for Sackville-Cobequid, but as the health critic, and to hopefully get some of the issues out in the open and get some answers from the minister. But of course, everybody knows, just coming off the election, that health care is the #1 issue, I think, for many Nova Scotians. They have a lot of concerns, and those concerns increase when themselves or a loved one has to enter or is involved in the healthcare system here in the province. And I want to begin by stating that I believe that we have some of the best healthcare providers in the country, if not in the world, here in Nova Scotia. And by no means do I take away from the delivery that these healthcare professionals give to the patients and the residents of Nova Scotia by the questioning and the concerns we have in different departments, because it doesn't reflect the job they do. It just reflects the issues and the concerns that I think not only our province is dealing with when it comes to healthcare issues, but what the country is dealing with around healthcare and the delivery of healthcare in what people, I think, perceive should be a timely manner. And those are a lot of the issues we'll talk about, or I'll talk about in the next hour, and then probably over the hour I get tomorrow, Mr. Chairman. A lot of the issues around the new diabetic, the low-income diabetic program that we're very proud of advocating for many years. I know the member from Halifax Needham have been pushing for a program to exist here in Nova Scotia, and we were happy to support that last year, Mr. Chairman, in this province. But there's still a lot of questions and a lot of issues around the delivery of that program and how it's supposed to target those low-income Nova Scotians in hopes to improve their lives when they're suffering with the terrible disease of diabetes, Mr. Speaker. I'm also going to talk a little bit and ask some questions around emergency health services. Definitely a passion of mine, being a paramedic and coming through a system that has evolved over the last 6 or 7 years to what I think is one of the best services in North America, Mr. Chairman. And but there is issues in there. There's several areas that we do need to improve or need to get some questions and some answers from government on. The other area that I'll talk a bit about, actually a bit of at length, would be around the wait times, Mr. Chairman, and that's to deal with every aspect of wait times, if it's elective surgery to emergency wait times and so on, Mr. Chairman. Also, a lot has been said, especially during the last election, around long-term care. I think all three parties have tried to address what we see as the proper way and the better approach, or the best approach, to hopefully address some of the concerns we see in long-term care. And those Nova Scotians who are waiting to go into a long-term care facility, or those Nova Scotians who know that, in a few years they may need to go into, or they have a loved one that may need to go into it, Mr. Speaker. There's a lot of issues around long-term care. Infection control and rates with some of the diseases here in Nova Scotia is on the rise, Mr. Chairman. I'll have a few questions around that. Of course, around continuing care. It's definitely another issue where I think we need to address, we need to put resources in, government needs to recognize the importance of investing in continuing care in hopes of reducing such a huge burden on taxpayers and the government spending of healthcare dollars. And I think by addressing some of the concerns and issues in continuing care, we can hopefully someday reduce what we see as a never-ending increase in healthcare spending in our province and, for that matter, across the country, Mr. Chairman. But most importantly, I want to talk today or maybe even tomorrow a little bit around an issue that is important and dear to my party, not only here in Nova Scotia but across the country, and that's the issue around for-profit healthcare, Mr. Chairman. We've seen Nova Scotia has been an area where these for-profit healthcare clinics or facilities have come into Nova Scotia to try to set up and test the waters, I believe, in how not only the Nova Scotia government will react, but how will the federal government react to for-profit healthcare system or for-profit healthcare facilities, not only here in Nova Scotia but in the country, Mr. Speaker. And that's an area where I think government haven't done enough. They've said that they would address this issue on a number of occasions, and I'll get into that in detail a little bit later. Another area, Mr. Chairman, is around the emergency rooms, especially around the closures of many of them for some reason or another, for mostly around the personnel, the human resource, the inability to have a physician man those ERs throughout the province. Many of them that close are in rural parts of the community here in Nova Scotia, and it's a stressful time for the community members to know that the emergency room that's maybe in the center of town is not available to them on long weekends and holidays, Mr. Speaker. I'll also talk a little bit around the use, and I know I've questioned the minister today on it briefly, but the use or underutilization of nurse practitioners in this province. I know the government has invested funds to increase the number of nurse practitioners and the training of them, but the government needs to continue that on to ensure that we have these professionals that I think can offer so much and be utilized to address so many of the issues that we have in the province, not at a smaller cost than I think most people think, Mr. Speaker, or Mr. Chairman, sorry. And I think that's an area where government needs to work quickly, because not only are we going to see these nurse practitioners leave, but we're going to see some of them unable to maintain their licenses, Mr. Chairman, and continue to practice. We have nurse practitioners now that are working in the province that are unable to work to their full potential, to the potential that they are trained, and I think that's a shame, and I think government needs to act quickly on that one. So with those few comments, I will get into breaking down the questions I have in each of those areas, and the first one definitely is around the assistance for low-income residents with the diabetic program that the government initiated last year. As I said, I know the member from Halifax Needham has pushed and advocated for this for many years, as I have since taking over the health critic portfolio for the caucus. And it's an important area because not only does it hopefully, I think, reduce healthcare costs in the end, it provides a service to those Nova Scotians who are suffering a terrible disease that can't afford to maintain and hopefully provide the instruments they need to hopefully maintain a good level of glucose, Mr. Chairman. And I think the program needs to be looked at to ensure that what the program was meant to do and the people the program were supposed to help actually do that. So my first question to the Minister of Health, through you, Mr. Chairman, is that why are these residents who are struggling to make ends meet required to pay for the products up front? And doesn't that defeat the purpose of this program? So why was that part of the program there to have an upfront cost to people in Nova Scotia who in the first place couldn't afford those products, to hopefully maintain and keep a tight lid on their disease with fighting diabetes, Mr. Chairman.
Thank you. The Honourable the Minister of Health.
Yeah, thank you very much, Mr. Speaker and Mr. Chair, and thank you very much to the member opposite for his introduction and now for the question on the low-income diabetes assistance program. Quite honestly, as we went into this program, we did not have the system in place to provide the pay so we could set up like a true pharmacare program, and we worked quite diligently, and I know my group has worked quite diligently on making sure that system was in place as soon as possible. I'm very happy to announce today that I think we have one more. That we sort of have one more retailer to bring online to the system. So I'm hoping within the next few weeks that people accessing this program won't have to pay their upfront costs for the diabetes supplies.
We're on. The minister stating that they have started to pay for that upfront cost, which...
Okay, the Chair will recognize the Honourable Minister of Health for clarification.
Sorry about that, and then just to provide a further clarification on that claims are now adjudicated electronically. So I think we just have one retailer right now that we cannot use because of a computer glitch, but hopefully they'll be online as well. So low-income diabetes people can get their assistance and just basically pay the copay as other pharmacare programs would.
Thank you. The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chair, and I know the residents who are trying to gain access to those products appreciate that, but it still doesn't leave the fact that here we are a number of months later when I think this part of the program should have been the first thing to look at would have been looked at by government. I mean, here's a program that was deemed to target those low-income individuals who can't afford to get proper product to hopefully fight their disease. So I'm glad to hear that. I'm sure the residents who are accessing that program are glad to hear that. And I look forward to hopefully that program expanding. So I asked the minister through you, Mr. Chairman, do you have the number of how many residents in Nova Scotia are taking advantage of this program, as of today, I guess?
The Honourable the Minister of Health.
Thank you very much, Mr. Speaker, or Mr. Chair. And I just wanted to comment quickly, is that sort of the question was with this program, because it was a very, I think, important program for this government, and one that we wanted to get going as soon as possible. So we sort of had to make a decision whether we wanted to wait until the electronic systems are in place, or get the medications to the patients as soon as possible. I think we made the determination that we wanted to get the therapies and the equipment and all the other things that it pays for to the patients as quick as possible. When it comes to how many people are accessing the program right now, I don't have that number, but I will endeavor to have that information to you by tomorrow.
The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chair. I appreciate that. Definitely we'll look forward to getting that information, because I think it's important that, as an opposition member, but Nova Scotians know who, or not who, but how many individuals are gaining access to government programs, especially an important program like this, Mr. Chairman. And what that brings me to the estimates and some of the lines in the estimate under the detail, and it's page 11.6 for the minister's information. Under it, we see the line for the assistant for low-income residents with diabetes, and last year's estimate was a $2.5 million investment, and of course the forecast was there of $280,000. So I'm just wondering if the minister could comment why such a difference in the estimates of 2005-06 of $2.5 million and a forecast or expenditure of only the $280,000.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And quite honestly with that is that the original budget of $2.5 million had a different start date. We figured we could get it in place sooner than anticipated or than we did. So the $280,000 represents a late start to the program.
Thank you. The Honourable Member for Sackville-Cobequid.
I kind of figured that might have been it, but I wanted to hear it from the minister. Definitely, I think that's one of the things we've seen from your government is that you announce things, but it takes a while for you to implement them. And an important program like this, I think, should have started pretty quickly after announcing this program. So that leaves, I think it was about $1.2 million that wasn't used last year. So of course we can take that off of this year's 2.5 million. So realistically, I think government is investing about 1.8 million for this year's program. Now, I see that the estimate for this year was the same as the estimate for last year's startup of this. What do you anticipate the use of that fund this year? Did you take into account potential growth in residents taking advantage of this program and possibly going over budget, or have you estimated a high ceiling on the cost of this program over a year?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And the $2.5 million represents the annualized cost. As we set up a program, we would, of course, do some research to find out what uptake would be. And uptake means over a number of years. And that research showed us that this would have an annualized cost for the first year of about $2.5 million. Of course, the expenditure last of the 280 basically represents a bit of startup and the utilization. We do estimate, though, over a 10-year period, with the extra uptake as it would go along, that we would probably see a total program cost of somewhere near $9 million.
The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chair. And I know the minister said he'll get me the information on how many residents are using or are taking advantage of the program now. But when the startup of this program was initiated, you must have used a figure of what you thought or guesstimated how many residents would use this program. So does the minister know when they did the estimates for this year what they projected would be the number of individuals in Nova Scotia taking advantage of this program?
The Honourable the Minister of Health.
We're still trying to get that information, but I know when the research is done, you look to see what the uptake is, see how many low-income diabetics we do have in the system, what the projection of new cases will be, and what the projection of cost of drugs will be. But we'll get the final information for you to make sure you have the correct. But it does represent, like I said, over the next 10 years. In about 10 years' time, it'll be at about a $9 million program. But also to say, Mr. Chair, as people apply and they qualify, they will belong to the program.
Thank you. The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chairman. It's my understanding, maybe the minister could correct me, that there was some kind of a review done of the program. Is that correct?
The Minister of Health.
Thank you. There was a fairly extensive review done by our pharmacare people within the department, looking at other jurisdictions to see what the uptake was in those areas too that have similar populations, similar programs. So, like I said, we'll try to get that information to you on the uptake, what the projection of that uptake will be this year, next year, and into the future. But again, Mr. Chair, as we estimate what the number is, I can assure all members in this House that should people apply, they will be covered.
The Honourable the Member for Sackville-Cobequid.
Thank you, Mr. Chairman. And I hope that, I look forward to receiving that information and hopefully a copy of what the findings were in that review. And I hope and I encourage the government, the minister, to promote the fact that we have this program, because these individuals that have low income in our province aren't sitting in front of computers and don't have access to probably papers and stuff. They're struggling with their daily lives. So I hope that all effort is made to make sure you reach those individuals through community groups or through community services or any other groups in the province to ensure that they know about this program and that they can take advantage of it. So what I'll go to now, Mr. Chairman, is around emergency health services, EHS, and a few questions around there. On the next page in estimates, I'll use some of the lines under emergency health services on 11.7. And I had a question around the ambulance subsidy payments. Last year, the forecast was $61 million, and this year the estimate is around $63 million. So it's an increase of about $2 million. What would that $2 million increase, what is that for? And can the minister give some information on the $2 million increase from this year over last?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And most of what you see there in the increase would be contractual obligations for increases. We look at the 2005-2006 paramedic wage settlement. Look at the contractual increase in the ground ambulance. Also within that, you can talk about the fixed wing contract. When some backup costs that were required there, some contract increases for life flight. Of course, aviation fuel increases because they are a global piece in there as well. Setup costs for the paramedic college, as well as some additional pieces, trauma AMT program, and other things held within that program. So they do talk about mostly contractual items within that system.
The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chair. Why I ask that, because it doesn't seem like it's a huge increase, especially around the fact that, and I don't know if the minister is aware of this, but the paramedic contract has actually expired last year. So I know that in the coming months, hopefully, we'll see some evolution of that contract being signed. So has the minister taken that into account? Has EHS come to the minister and his department and stated that we have the paramedic contract due to be signed, hopefully, and ratified over the next or the coming months?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite, and assure him that the funding has been put aside for that contract talk, and to be making sure that the amount of funding is there. But all labor negotiations as they go forward are held centrally through, I think, Treasury Policy Board for movement within each department as those contracts come available. So it's very difficult to say how any one piece of negotiation will come out. So that is held centrally, not directly within the budget of the Department of Health.
Thank you. The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chair. Hopefully, thank you, Mr. Chair. And hopefully, the minister recognizes the importance to continue to recognize the paramedic profession in the province, especially after one of his answers to the question, I think yesterday, around the closure of emergency rooms and the lack of emergency room physicians in areas of this province. And the minister stated that one of the directions that the community uses is to call 911, and that, of course, is the paramedics who are on standby throughout this province. They play an important role, and I think we need to continue to recognize the service that they provide on a daily basis, but the additional service, like being dispatched to an emergency room that is closed. It's been going on for many years, and they're more than welcome to provide that service for the residents of their community. So under the next line, actually, it caught my attention a little bit too, around the communications and dispatch Mr. Chairman, and the estimate or the forecast of last year of $2.8 million and this year of $1.6 million, which is a reduction of about $1.2 million. And I know the member from Hants West, I believe, may be interested in this, where he is newly elected, and it comes from the communication and dispatch portion of EHS. So I'm wondering why such a reduction on that line this year in the estimates for that communication and dispatch.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And to show the change in that and why there's a decrease, it basically represents that we had the opportunity to purchase some equipment at the end of last year to bring forward. So it just represents that throughout the year that we will be spending less because it's already been purchased in a prior year.
Thank you. The Honourable Member for Sackville-Cobequid.
Okay, thank you, and I guess that's why we're here, so we can jog not only your memory, but my memory of what happened. I do remember talking about that. So a couple lines underneath is an area which is very important in the province around emergency health services, and that's with medical quality control. They play an important role in ensuring that residents are protected from the people that are providing services to them. As a result of quality control, we can improve the profession, not only the paramedic profession, but it's the same in all professions, such as the technologists, the nurses, and even the physicians, Mr. Chairman. And we noticed last year the estimate was around 400, almost $500,000, but actually ended up costing $740,000. And then this year it's back down to just under $600,000. So first question, I guess, is what was the indicator, or what happened that had such an increase in the estimates to the forecast of last year's budget?
The Honourable the Minister of Health.
All right. Okay, so variance between 2006-2007 estimate and the 2005-2006 forecast, which I think is what you're referring to there, which shows basically a decrease of $140,000. The decrease was due to a purchase of medical drugs and supplies, so again, a prepay from the year prior, and an increase of $80,000 for the setup of the paramedic college. And then if we're looking at the difference from this year, again, the governing body for paramedics, there's about $100,000 or so increase in order for the operation and the technology and the project manager and those kinds of things for the setup of that paramedic college.
Thank you. The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chair. I don't know if that really, I can figure out what really caused that, because I think the minister mentioned the paramedic college in another line item, but I'll go on with that. I want to talk about something that I've talked about in the past around Life Flight, and that operation is an important aspect and component to emergency health services here in the province, especially for our rural residents who depend on getting to the tertiary care hospital here at the QE2. Not only do our own residents depend on it, residents in Atlantic Canada. We have a great hospital, and it's important, in some aspects and sometimes in medical emergencies to get to the QE2 emerge. And Lifelight has filled that hole, and I would love to, hopefully down the road, see an expansion of that. But we recently did have a move that was a bit controversial around the pediatric crew moving from their base out at the airport, which is right next to where the aircraft sits, back to the IWK. And I know that falls under the IWK budget line. But I would like to ask the minister if there was ever a review or an audit done since the movement, since the pediatric team moved from the IWK or from the airport back to the IWK. Has there been a review of response times with that move?
The Honourable the Minister of Health. If I what?
Thank you very much, Mr. Chair, and to the member. In reference to the Life Flight and the pediatrics team at the WWK, since the moving, and there's a various number of reasons why that team was relocated back to the WWK, and it really has a lot to do with maintaining their licenses and making sure that they have the clinical time in order to do their jobs and maybe able to keep up their skills. I wanted to assure the member opposite that there is a full review happening right now of the air ambulance system, but not only looking at response times and quality of service and a whole plethora of different things. Mr. Chair, if you look at the combination of the two programs, the ground ambulance system and the air ambulance system, and I'm going to say it in this thing, and he came close to saying it, but we do have the best EHS system in Canada, if not North America.
Thank you. The honourable member for Sackville-Cobequid.
Definitely, I'll say it now. I think we do have the best EHS service in our country, definitely. I hope that when this review is done, that it will be made public so that not only yourself can evaluate it, but as opposition member can evaluate it and make sure that was the right move. And I'm still left wondering if it was. I know that the minister mentioned that it was due to competency and ensuring that the members of that team are fully trained and get the exposure they need to continue on to provide a great service. But to be totally honest, Mr. Chairman, if the agreement that was set up originally when LifeFlight started, we wouldn't have to worry about that, because the agreement had these members of this pediatric team putting a portion of their time at the airport and a portion of their time at the hospital. But that was never happened, Mr. Chairman, because of course they didn't have the numbers to put out at the airport to fill all the shifts. I don't know who's truly at fault at that. I think government should have ensured that the original agreement that was set up was followed, and I don't think we would be here today discussing the movement of a pediatric team from being right stationed next to an aircraft into the IWK, Mr. Speaker. So I'd like to ask the minister that I do have concerns. I know a review is ongoing, I believe he stated, but I do have concerns that we don't see the same thing happening with our adult crew that is maintained out at the airport right now, who are presently on call waiting for an emergency throughout somewhere in Nova Scotia. So I would like maybe some assurance from the minister that the adult crew isn't being looked at as possibly being moved to maybe the QE2 or Dartmouth General to maintain their credentials when they hopefully will provide great service at the airport and give good response times.
The Honourable the Minister of Health.
Yeah. Thank you, Mr. Chair, and I would have to check on the status of the adult team and what the response will be on that, because I'm not quite certain at this point. Let me also tell the member opposite that the EHS medical directors are still tracking the missions, and since the move, there has been no change in LifeLab's ability to respond, and has had no impact on patient safety as of yet. So we are monitoring still quite closely from those medical directors at EHS. And also to bring to the attention of the member opposite from a previous question, when it regards to the low-income diabetes program, that there are 1,308 people receiving service from the low-income diabetes program. 1,308 as of June 16th.
Thank you. The honourable member for Sackville-Cobequid.
Thank you, Mr. Chair, and I'll emphasize the fact that the adult team actually for LifeFlight actually are quite busy, and I think the minister has to do everything he can to ensure that they're there, ready to respond to an emergency in our province. Like I said before, majority of their calls are to rural communities, but they also, the adult team provides service to around HRM with scene landings. They frequently, if there's a bad accident, say on the way to Windsor on the highway, Mr. Chairman, will actually respond to there, where it could take you, say, from St. Croix to Halifax, 40 minutes with your lights and sirens on, where the Lifeline crew could do that in I think a tenth of the time. So it's an important service that I think I need to emphasize that should remain at the airport, and I look forward to the report. So now I'll turn to an area that we hear about a lot. I bring up a lot in question period, and I know the minister and all government members hear about, is that around wait times in Nova Scotia. And I provided the minister with a copy of the operational measures indicators, because I'll refer to that for a few minutes around some of the issues and the benchmarks and the targets that are in place to hopefully be a guide to provinces to hopefully be able to meet those requirements and those targets, Mr. Speaker. And when you read through it, I don't know if Nova Scotians have seen this, but it's very scary when we look at wait times in general for all aspects of health, Mr. Chairman. It's very scary. And I'd like to touch a little bit on some of them now. And the first one is around the percentage of emergency patients leaving without being seen, Mr. Chairman. And the benchmark for this is around 2%. So 2% of the population that goes in, the residents that go into an emergency room and walk away, that's the benchmark. And I've talked about this before, and I'll mention some of the numbers for Capital Health. I don't have the numbers for all regions, but I know these are the most significant ones that are quite high, actually, Mr. Chairman. And with this, we can look back to February 2006. I know that there's a new report coming out, I believe, this month, any day now, and maybe we'll get it before the end of estimates, and I can reflect on them. But for the year or the month ending February of 2006, we look at the Dartmouth General has a 7.6% of their patients who go into the emergency room to be seen walk away. And at the Dartmouth General, we have a slightly lower of 4.7%. So they're a little closer to the benchmark, people who go to the Dartmouth General to seek some assistance from the emergency room end up walking away. But the most interesting numbers, which I have great concerns with, is the numbers at the Cobequid Centre, Mr. Speaker. The community health centre that is in my riding that services well over 100,000 people here in HRM has a percentage of 12% this in February, Mr. Chairman, 12%, and the target is 2%. If we look back a year ago, that has doubled at the Cobequid Centre. It was 6.7% last February in 2005. Now it's 12%. And this is an emergency department that is only open from 7 in the morning till 10 at night, Mr. Chairman. So my question is, when you look at these figures, and you hear time and time again from government that we're going to increase spending in health and try to address some of the wait times, what is the minister going to do, or what is he doing to try to address these wait times, especially at the Cobequid Centre when they're 12% walk away when the target is 2%?
The Minister of Health.
Thank you very much, Mr. Chair. And it's interesting to quote that kind of report and that kind of wait time. It's really not an indicator of wait time. It is a concerning issue to have people walk away when they require care. The indication is, when we talk about that, is these are very, very much so less acute. But you really have to also take in what people's expectations are and what they feel they should be waiting for certain things. And it is something that concerns us, and it requires a lot more oversight in the next bit. The Cobequid issue of being so high, I think, is really attributed to a new facility being, unfamiliar with the facility, being unfamiliar with the services and the actual utilization as it went up, and we need to make some adjustments there. But Mr. Chair, I can assure all members that this is an indicator of CDHA. It's not necessarily an indicator of all other ERs as well. There are different utilizations across the province, and the 2% is something we strive for. But it, of course, depends on the day, the acuteness of the items, and of course, the expectations of those patients. But if we look at true wait times and how long they're staying in an ER, I think that's something that we should be trying to address.
The honourable member for Sackville-Cobequid.
Thank you, Mr. Chair, and I appreciate the comments from the minister, but we don't have to look back too far around the Cobequid Centre. We just look back in October '05 when the new facility wasn't open yet, and the walkaway numbers or percentage was 11.7%, so it was almost the same. And to tell you the truth, it probably is even higher now with the new facility, because yes, I've talked to many of the staff there that have seen an increase in residents that have normally gone to the other two areas, the Dartmouth General and the QE2, are now trying to go to the Cobequid Centre because they maybe assume that with the new facility that things will be quicker. But I tell you, that's not the case, Mr. Chairman. So I know the minister had mentioned the acuity level, or they may not be as severe as or as high as the people that go in there may not need the full service of an emergency room physician or an ERP. But that takes me to another chart in this report around the average emergency wait times for acuity level 3 patients. And these are patients that need urgent medical attention. They have a serious issue or a serious problem that needs to be addressed, and the target for that is within, I think, 30 minutes by a physician. So if you come in to an emergency room here in the province, they give you an acuity level, and one is the most severe, where you need medical attention immediately, or the possibility of death is very likely. And of course, acuity 5 is those less urgent, someone who might need some stitches or a sprain. So acuity level 3, they are in need of medical attention, and they have targets that have set up that they need to see a physician within 30 minutes. And those wait times are astonishing also, Mr. Chairman. We look at the Cobequid, which fortunately is one of the lower of the three that I'll mention, is about 101 minutes that acuity level patient waits in the emergency room after being triaged to the time where they see a physician. The Dartmouth General is about 114 minutes. So they're a little bit higher than Cobequid, where they wait 114 minutes before being seen by a physician after being triaged by the nurses at Dartmouth General. But the QE2 is 144 minutes, Mr. Chairman. And they go in, that's after you've been triaged by the paramedics at the QE2, to the point where you see an emergency room physician. And the target is 30 minutes. So there's another indication of a problem we're continuing to see when you look at acuity level 3 wait times, when we look at patients leaving without being seen. So when it comes to that, I wonder if the minister could elaborate why he thinks those numbers are so high, and is it really realistic for this government to expect to meet the targets of 30 minutes for when we're dealing with patients like who have acuity level 3 who are trying to be seen by a physician in the emergency rooms here? And I know I said 3 local hospitals, but in Nova Scotia.
The Honourable the Minister of Health.
Thank you, Mr. Chair. And the reasons for long wait times, especially in an emergency situation, can revolve around a whole bunch of issues of why, time of day, the actual amount of people that are sitting in the waiting room, and how busy it is. Whether or not there are some people waiting to get bumped up into a bed, and maybe the unavailability of that at that time because of either ALC or other issues happening in the hospital at that time. But Mr. Chair, I can say that this is a challenge for us to find those root causes, and B, to have the solutions for them. Sometimes they revolve around, of course, what we're talking about in continuing care, and finding places to move some of these alternate level of care people on to facilities where they require, to having more physicians and more nursing staff. Also to the point, that as I said in one of the questions earlier, that we have the second highest physician-surgeon ratio in the country, yet we seem to have a discrepancy in the amount of time that people are waiting for minor procedures and ER visits. Level 3, of course, revolves around bleeding, some respiratory, and those types of semi-serious ailments. So it does concern us that it is 133 minutes, I think, for capital health. The unfortunate part is that's not a bad wait time compared to some other facilities around the province. So we have a true challenge right across the province to make sure that we have those wait times down to a place that are acceptable, and I got to say medically acceptable. We need to find what that time is, and I think the benchmark reflects a medically acceptable time. You know, and I'm sure that even when I have to visit an ER at some, I would like to be seen immediately, but we know full well that can't happen, depending on the acuity of your ailment as you visit there. Which brings us to the point that we need to have a better analysis, I think, of primary health care within the province, and having opportunities for patients to visit places other than ERs. In some cases, you can get your stitches and you can get your whatever your minor ailment might be in other facilities, whether they be some kind of primary health care, and it might be a community clinic. And I think those are the things that we have to be continuing to focus on to take some of that load off of our true emergencies and let them be true emergency centers to deal with the 1, 2s, and sometimes 3s, but to have those 4s and 5s dealt with outside the system, which does create lots of blockage at those facilities.
Thank you. Now a member for Sackville-Cobequid.
Thank you, Mr. Chair. I appreciate those words, and I was anticipating the minister to come up with a few more reasons why we see such times or waits in our emergency room, and he did say one important word is beds, waiting for a bed, and I was hoping he'd continue on with that, because I think a large portion of this, and I've said it in the past, I know the previous Minister of Health and the one before that, and have often stated that the crisis we see, especially in the emergency rooms, aren't a bed issue. And I get so frustrated when I hear that, Mr. Chairman, because that's the case. It's a bed issue. Many of the problems we see, and I could still go on and talk about diagnostic procedures, the wait times for those, we're nowhere near the benchmark. I could go on and talk about elective CTs. The wait times are nowhere near the benchmarks. I could go on to elective MRIs. We're nowhere near the benchmarks. And a lot of these stem from the fact that we can't do them because we have nowhere to put these patients if they need to stay in the hospital. It's a domino effect, and it brings me to the long-term care issue that we see in this province, Mr. Speaker. It's been neglected for far too long, and we're seeing the repercussion of this right now in the wait times, in our emergency rooms, in elective surgeries. We're seeing the problems because that area of health care, long-term care, continuing care, has been neglected, not only by this government, I believe, but by the previous government and governments before that. And, they didn't have a vision of realizing what we're going to need in the future, and we need long-term care beds now. And I know the government has a 10-year plan, Mr. Speaker, but in 10 years, God knows what we're going to need at that time. There's no way you can tell me, there's no way the premier of this province can tell me that they know what they're going to need in 10 years. I just don't believe it. I don't think many of the members in my caucus would believe it, and I don't think many of the residents of the province would believe that they can predict and try to manage what we're going to need for long-term care in 10 years from now, Mr. Speaker, because we need them now. And that domino effect goes right through, back out into the communities. It starts with those individuals, those Nova Scotians who are in the hospital for some reason or another, had a fall, maybe an increase of dementia that they may have, and they realize that they can't take care of themselves now, and there's nowhere for them to be placed. They're put on a waiting list for a long-term care facility. Well, a hospital is not a place for an individual who needs other services. It's great when you need emergency services, you need a medical service, that's great. And we have great hospitals in the province. We have great physicians, surgeons, technologists, healthcare professionals provide that. But a hospital is not the environment that these individuals need the care from now. They need to get into a long-term care facility or a small options home where they can maybe have interactions with other residents. That's what's missing when you have these individuals laying in hospital beds on floors throughout this province. It's deemed a hospital for medical treatment, not for treatment of our seniors, our aging population. They're missing a huge ability to hopefully improve where they're at in their lives. And I think that improvement comes from that association with other residents, with their family members coming in, visiting with them, taking them out of say, a long-term care facility to around the community, or even just outside into a garden maybe, Mr. Chairman. And that's where we need to realize that we need to work quickly, not in 10 years. I know the minister has stated in 4 years, the majority of these beds will be built or the new facilities will be built, but we're in a dire need of them right now. And I don't have to point too far. I point to my own riding and my surrounding riding, Mr. Chairman, of a long-term care facility that was deemed necessary. I would say it was before this government, 15 years ago. I remember them talking about certain locations in Sackville that were going to be looked at as a long-term care facility. And here we are now, 15 years later, still waiting in that community for a long-term care facility. And we have patients or residents in my own community that are living quite a distance, and it may not be the 100 kilometers that some of the rural residents have to endure. But I tell you, when you have an elderly person living in Sackville, and their loved one is in Cole Harbour at a nursing home or in Eastern Passage in a nursing home, they can't get there if they don't have a vehicle or other members of their family. They can't get there enough to see their loved ones. So it's an issue here in HRM. It's an issue in the rural parts of our province. And I think we need to hopefully encourage government to step this up. And I think the residents will let the government members know, let the Minister of Health know that, it's good to see that you have a plan now, but I think you need to make that plan roll out a little quicker, and that we need to start addressing those needs. Because like I say, that domino effect, we have that patient who is now laying in a hospital bed, and now you have someone who may have been in the emergency room who needs to be admitted now to the hospital, who can't be admitted because there's no beds to go upstairs to. And what does that do? There's a patient laying in an emergency room bed, which was deemed to provide emergency services, emergency care, and they're meant to see many patients. So that one bed in the emergency department now is tied up by individuals for hours on end, and even for days on end, Mr. Speaker. I know the member from Pictou East was telling us earlier in the week about someone in his riding or actually it was, I think, a family member who was in the emergency room for 3 days, Mr. Chairman, 3 days. I mean, that's just not the place to be when you're ill and you need other services other than you need in an emergency room. Because, Mr. Speaker, Mr. Chairman, I've been in the emergency rooms thousands of times, and you don't get no rest there, Mr. Chairman. You don't get no interaction with staff on a level you would have on a floor in a hospital, Mr. Chairman. It's a fast-paced environment where you have people dying in the next bed, Mr. Chairman. People dying. People die in the emergency rooms in Nova Scotia. And here you have a patient that should have been days prior up on a floor to try to get well and hopefully get out of the hospital, because I think that's all our goal is to not be in a hospital. It costs this government, it costs taxpayers hundreds of millions of dollars to have a bed or to occupy a bed in a hospital. So as I said, it's a domino effect. Then you look at the emergency room. Why do we have patients leaving the emergency room? Because they can't get in to get the care they need and the care they expect. And I've heard a lot of people say, well, if you're in acuity level 5 or 4, you probably shouldn't be in an emergency room. But Mr. Chairman, we can't cast judgment on an individual who, in their own life at that time, their own environment, believes that they're going through an emergency, they need the assistance of a doctor, and they end up at an emergency room. We can't have that mentality. And we need to give them every opportunity to seek that help they need, or seek the assistance of a physician that they need in a timely manner. And that domino effect goes right out the door into our communities, because not only if there's a wait in the emergency room, you have paramedics, ambulances, that go to an emergency call in the community somewhere in the province and end up in our emergency rooms. And I'll use an example of the QE2. Many times, as a paramedic myself, would end up there with a patient, and we were unable to transfer that care over to the emergency room staff. So policy states that the paramedics treat that patient. That patient is under the care of the paramedics until that transfer is done and complete. So we have paramedics now, and myself, taking a leave 3 years ago. The waits for me on average was a half hour to 45 minutes. At an hour would be excessive, but I can tell you, Mr. Chairman, to the Minister of Health right now, we have paramedics going to the QE2, for example, and are waiting 4 hours with a patient on their stretcher to do that transfer over, because there's no beds. And why is there no beds? Because I believe that domino effect, if you look right up through the system, is that we have too many people in the hospital and not enough beds. And so you look at some community somewhere in the province now is without an emergency vehicle. What happens if it happens on a night where the emergency room is closed in one part of our province? We have one paramedic or one ambulance crew covering that emergency room. We have more ambulances being delayed at emergency rooms than others. So we have a systemic problem throughout where people aren't getting the service that I think they deserve and need. So I know I went on a little bit longer there, but it's important that we recognize that it's a bed issue. And one of the main things we've all heard during the campaign, and we all campaigned on, was long-term care. That's an area we need to start addressing. We need to look at supporting continuing care and long-term care. And I know the government has a plan, but as I said earlier, Mr. Chairman, it's over 10 years, and we needed a plan probably 10 or 15 years ago. And that's what's been lacking in this province, is a plan and an avenue and a road to go down to start addressing the needs of our aging population. I don't know the figures, but in the next several years, the number of our population over the age 65 is increasing by large amounts, Mr. Chairman. And I think that when that happens, we're going to see ourselves in a tough situation. And I hope that I'm still here representing my area, fighting, hopefully, but maybe by then we'll be on that side of the chamber. But I can tell you, through you, Mr. Chairman, to the Minister of Health, if they don't start addressing this issue soon about beds and long-term care and community services, their numbers are going to continue to drop. And we will more than welcome more members to our caucus so that we can provide what we believe is a good plan to address continuing care and long-term care in Nova Scotia. So with that, I'll give my time to...
Thank you. The honourable member's time has expired. The chair will now recognize the honourable member for Glace Bay.
Thank you, Mr. Chair. Mr. Chair, again, welcome the opportunity to continue asking some questions of the Minister of Health and his department. If he could look at page 11.4 of the supplementary detail under the heading of Executive Administration. Mr. Chair, the department has grouped together all of the executive administration under one heading. And in previous budgets, each of the offices and general administration was provided in greater detail. So I'm kind of asking the question why that has been done. For instance, in the 2005-2006 budget, the estimate amount for general administration was about $2.3 million. In the 2006-2007 budget, the estimate amount provided for 2005-2006 is just over $3 million, which is about $71,000 higher. My question is, what has been added to the estimate amount presented in this year's budget to make the two 2005-2006 estimate figures completely different? Just a clarification.
The Honourable the Minister of Health.
Thank you very much, Mr. Speaker. Could you, just to clarify which page you were on referring to? 11.4. And you were... Now, if we look at page 11.4, I know he's referring to general administration, which is the top line, which shows the estimate of $2.939 million. Is that what you're referring to there? Okay. Because then underneath it, you see chief finance office, chief information office, chief health human resource office, chief policy, and all those separate offices as they were laid out. Forward acute tertiary care, mental health program, continuing care, are all separately listed below it. Okay, and you were asking, and we just want a clarification of what he wants to see for general administration.
The Honourable Member of Glace Bay.
Thank you, Mr. Chair. If you look, the 2005-2006 budget, the estimate amount for general administration was about $2.3 million, correct? 2.3 million. The estimate amount provided went up to $3 million, which is it's just over $71,000 higher. So I'm asking what's been added to make the two figures different.
The Honourable the Minister of Health.
Okay, we're getting there. Because if you look at the estimate to estimate 2005 to 2006, you're looking at actually a decrease there of a few tens of thousands of dollars, because the estimate of 2005-06 was what, 3,047,000 whatever, and this year we're looking at 2.9 million. So we're looking at a decrease from last year, right? Okay, why was the decrease? Okay, just want to be sure we're getting the right point. Okay, there was a decrease in communications officer positions, and executive director education renewal, I believe was the point showing here. There was a transfer of secretary 3, some miscellaneous expenses of about $40,000. Yeah, so the transfer of secretary 3 would show about $49,000, and the communications executive director education renewal was deleted, I believe. The position we didn't require from last year this year.
Thank you. The Honourable Member for Glace Bay.
So maybe I'm not being clear enough, Mr. Minister, but an estimate, right, is a figure that should remain identical, so that when government is able to determine how much under or over budget that in one particular office or budget area at the end of the fiscal year. So when you estimate the amount at $2.3 million and the forecasted amount is $2.8 million, then that would appear that you're over budget by about $500,000. Am I right? Again, from changing the estimate number for 2005 and 2006 in this year's documents, you're actually giving the appearance that you underspent by about $200,000. But I'm looking to know why the two estimate numbers for 2005-2006 fiscal year, they're not identical in the 2006-2007 budget document. So has your administration budget increased by $500,000 over last year? And if it has, then in what areas of general administration was the increase? Any clearer?
Thank you. The Honourable the Minister of Health. The honourable member for Glace Bay.
Mr. Chair, in the interest of not wasting too much time, perhaps the minister can get back to me at a later time with the. It's just a clarification matter of some figures there. I'm not accusing the minister of hiding any money or anything, but well, you can never tell. Mr. Chair, Mr. Chair, let me turn your attention then, please, to the estimate amount for communications in the 2005-2006 budget under communications. It increased by about 29% to almost $800,000. The entire communications budget for the Department of Health has increased by 116% since the year 2000. This year, the amount that's budgeted for communications is not being provided. So could the minister please indicate how much is budgeted for communications in the 2006-2007 budget?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. I'm going to be quite honest with the member opposite. We're having a tough time trying to find the lines that you're speaking of. So if you just bear with us here a second. Under communications. What page? Could you reference the page and line?
We're finishing here at 5:59. The Honourable the member for Glace Bay.
Mr. Chair, again, it's an item. If the minister wants to get back to me, that's fine, but it's under, I haven't noted in my notes the exact line item, but it is under communications. And there is nothing there. This year, the amount budgeted for communications is not provided. But if the minister has found that information now, then perhaps we could hear from him now, Mr. Chair.
Thank you. The Honourable the Minister of Health.
One thing, now that we're trying to get ourselves in line here, and I apologize to the member opposite, we were carrying one communications officer for the senior secretariat for some time, and I think we still hold that one. But I will endeavor to get that information to you, just to give you an outline of what the communication requirements and why the numbers are not quite in line.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair. Just to give the minister a general idea of what I'm looking for here is how do you increase the budget for communications by 116% since the year 2000? And surely one employee isn't making that much money, I don't think, within the Department of Health. Not even the deputy minister gets paid that much, I don't think, Mr. Minister. So if you could give me that information. Let's change the focus a little bit then, if you would, please, and to addiction services, Mr. Minister. And this one is on page 11.2 of the budget. You indicate that you're providing additional funding to maintain the Capital District Health Authority's methadone treatment program. Direction 180, I think, is the name of that program. The overall budget, though, for addiction services in the Capital District has decreased by just over $1.8 million, almost $2 million decrease. So even though you provided increased funding for Direction 180, the funding has decreased. So I'm asking the minister what has been cut because of that decrease in funding.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite. The decrease would show the transfer of the Choices program to the IWK. So it went from one district to another district. So it doesn't represent an overall decrease in the program. It just simply one program got shifted to where it belonged, was with the IWK.
Thank you. The Honourable Member for Glace Bay.
Well, and what's the reason for that I need a little bit further explanation, Mr. Chair, if I could, from the minister, and the reason why. If there's why is that reduction, and where did it go again, please? I didn't quite follow that, Mr. Minister.
The Honourable the Minister of Health.
Thank you, Mr. Chair. We had the program for mental health, and I think it's what you're referring to there, and showing the decrease in the program. If we look at, I believe, the transfer of the Choices program, which is an adolescence program, and that got transferred to the IWK. So you'll see an increase of the same amount in the IWK Health Center budget of about, I'm not too sure what the total cost on that one was. We're just trying to get those numbers forward. But anyway, it's the transfer of that Choices program, which is an adolescent mental health program, from Capital District to IWK under the mental health programs.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister, in every other district, in every other district throughout the province, you've seen a very small increase, even if it's in the vicinity maybe between $8,000 and $14,000 increase. Cape Breton district had an increase of $38,900, and I'm wondering, does that enable the Cape Breton district to continue with an adequate methadone treatment program, especially given the challenges that they've had in that area, in that district, with the abuse of OxyContin?
The Honourable the Minister of Health.
For their methadone treatment program.
From the Deputy Minister, I'm fairly confident that the $38,000 does represent the regular increase that was asked for by the facility to administer the methadone program, plus some ancillary costs that were required for that program.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair, Mr. Minister. Until very recently, this province did not have an abstinence-based treatment program for addictions, but recently, after years of hard work by a group of dedicated volunteers, the Crosby Centre has opened its doors. Prior to the Crosby Centre reopening, some residents of this province were being sent to Ontario or British Columbia. And my question to the Minister then is, how much will this centre save the province in terms of enabling Nova Scotians to get treatment here at home?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And I think the numbers that the member opposite is asking for will be very difficult to ascertain because, of course, it's the choice of the patient whether they go to private or private system as the Middleton one provided, and those kinds of treatments to what's being offered today through the District Health Authority in that facility that the member refers to. I think. I'm just trying to think, lost my train of thought there. But simply that we're trying to increase the financial dimensions of that budget, and I think we've seen an increase right now in mental health and addiction services of a fair amount, total of about $4.7 million to try to catch up to where we belong.
Thank you. The Honourable Member from Glace Bay.
Mr. Chair, the minister is saying that's a difficult figure to come up with. So if you can't tell me how much that centre is going to save the province in terms of letting Nova Scotians get treatment here, then how much did your department spend last year sending Nova Scotians out of province for abstinence-based treatment?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. We did not pay to send patients out of province for that kind of treatment, so we wouldn't have tracked those kinds of numbers.
I'll ask the minister, who paid for it then, Mr. Minister?
The Honourable the Minister of Health.
If they chose to go, they'd have to pay for the private.
Thank you very much, Mr. Chair. That would have been either paid for by the individuals or through their insurance programs if they were lucky enough to have one. But then that was done by the patients themselves.
What we have.
The honourable member for Glace Bay.
Thank you, Mr. Chair. Let's take a look, if we might, please, at other insured programs. Page 11.6 of the supplementary detail. And last year, when the low-income diabetic assistance program was announced, the department indicated it would be an $8 to $9 million program when fully functioning. Last year, $2.5 million was budgeted, and $280,000 was spent. So my question for the minister would be, would making patients buy their supplies before they actually get a reimbursement, would that be a reason why there's been such a low take-up on this program?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And that would represent a late start, number one, for the program. Of course, we started it in January of this year, which is a few months later than we had anticipated when we created that estimate. And it also would represent lack of knowledge in the community of the program and the actual uptake of it. So as we boil it down, that through the next year, we expect to spend that $2.5 million. And I think once it's fully subscribed to the demographic that we feel is representative of that, would be somewhere close to $9 million per year.
The honourable member for Glace Bay.
Thank you, Mr. Chair. To the minister, then, is this still the case? Do people who are eligible for that program still have to pay up front and then get reimbursed?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and I'm very happy to report that that is no longer the case. Of course, the reasons were we didn't have an actual IT program to use to interact with the pharmacies when it came to paying for this in a normal pharma care program. And I'm very happy to report to this House that is no longer the case, I think, except for one retailer that we're still having some problems in sharing the data back and forth. So as it stands today, that these folks would be able to get access to that program as they would a normal pharma care program with a small copay.
The honourable member for Glace Bay.
Thank you, Mr. Chair. I'm pleased to hear that, Mr. Minister, and I'm also like to know, though, just how many participants are in the program right now, and what you plan to do about marketing that program, so as many Nova Scotians as possible can know that has now changed in the program, and that the program is available to begin with. But that's an important change in that program, because we could never understand why in the first place that program was established under a pay up front and then get reimbursed method. It just didn't make any sense to us. So I'm glad to hear it. But how many people are involved in the program right now? And what's the department going to do about marketing that program to tell everyone that it's available?
The Honourable the Minister of Health.
So far, I'd like to make 3 points to that to answer the question on how many people right now. There are 1,308 people as of June 16th that are on the system. Secondly, I want to say that we're working with the pharmacies and the physicians themselves to make them aware of the program so they can make their patients aware. And I do believe that there is some information being handed out by the Department of Community Services as well on this aid, and then it's available across the system. To the point of why the patients were paying up front, it really boiled down to our contractor or our service provider was changing systems at the time and did not have the ability to take on the new load. And we felt it was important to get the program out there and get the products available to these diabetics so they can keep themselves well. So it wasn't the best way to do things, yet I feel it was incumbent upon us to get the program out and get those medications to the people that needed them.
The Honourable the Member for Glace Bay.
Thank you, Mr. Chair. Under the title of Special Dental Plans, Mr. Minister, according to page 11.6 of the supplementary detail, special dental plans have about $157,900 reduction in their budget. Why that reduction?
The Honourable the Minister of Health.
Okay. Thank you, Mr. Chair. It basically represents a utilization decrease of about $173,000. You know, if you look at the way it's laid out here, is that if you look at an estimate last year of about $1 million and the utilization of about $798,000. So we just adjusted that by the right amount because of that utilization decrease.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. Could the minister tell us what's included in those special dental plans?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And that program represents some challenging dental problems that children under the age of 10 would be experiencing. They would include some ortho work, braces, those kinds of things, and some from required. But it does represent the lower utilization in that program from this year over last year.
The Honourable Member for Glace Bay.
So the minister's saying that's not actually a reduction. Is that what you're saying, Mr. Minister? There's no reduction in that program?
The Honourable Minister of Health.
It's not a forced reduction, it's just representative of lower utilization for the program, less people asking for it and less people requiring it. So it just represents the utilization that was experienced over the last number of years.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. Okay, Mr. Minister, let me draw your attention to a line item called Special Programs, and let's deal with hopefully what is another reduction that you can explain for us as well. There's a budget of $300,000 for special programs. That's a $50,000 reduction from last year's budget. So what specific programs are included in special programs? Two questions, if you might, Mr. Minister. What programs are included, and why the reduction in special programs?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And special programs would represent annual payments to hemophiliacs. And again, it would be the same issue. The utilization is down on that, so it's representative of that utilization.
Thank you. The Honourable Member for Glace Bay.
Thank you, Mr. Chair. You're batting 1,000, Mr. Minister, so far. So let's continue with other healthcare initiatives with another reduction, so to speak, until I hear your explanation. It would appear that on page, if I can direct your attention to page 11.8 of the supplementary detail, it would appear that the biological budget, it appears anyway, that it's been reduced to zero. Is this the case, Mr. Minister, or has that just maybe moved to another department?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and that would be representative of a transfer to health promotion and protection. I think you'll see that repeat itself a few times throughout our budget of a transfer of programming from the Department of Health to the Department of Health Promotion and Protection.
The Honourable Member for Glace Bay.
And just for my clarification, Mr. Minister, as well, this is that not the budget from which flu vaccinations and children's vaccination program, is that the budget that takes care of that?
The Honourable the Minister of Health.
In a perfect world, I'd just say yes, but sure. It is the publicly funded vaccine to children and adults according to Nova Scotia's immunization schedule in order to prevent vaccine-preventable diseases and improve the health of the population. The funding provided is used to purchase vaccines required to deliver that immunization program. So that's exactly what it is, and it has been transferred to HPP.
The honourable member for Gleithway.
Okay, thank you, Mr. Minister. Thank you, Mr. Chair. Under on page 11.9 of the supplementary detail under other programs, grants and assistance has decreased by $884,000. Why the decrease on that item, please?
The Minister of Health.
We'll do is this. Thank you very much, Mr. Chair, and I think it's representative of a whole bunch of changes that would probably represent programs that are no longer required into programs that are being transferred to HPP. But I will endeavor to have that information to you hopefully by tomorrow. Oh, wait. Is that it?
Some of this is transferred if it's Nova Scotia. That's what we got there.
I'll endeavor to get that information to you tomorrow.
Thank you. The honourable member for Gleithway.
Thank you, Mr. Chair. I don't mean to be flippant, but whole bunch just doesn't cut it, Mr. Minister. Okay, so maybe if I'll take that commitment to provide it tomorrow, because there are, there are a lot of questions there whether there are any specific grants or assistance that has been decreased, and a list would be good, Mr. Minister. Let's put it that way. A list would be helpful. And I'd also like to know, is this the budget item that provides grants to community health boards, and have their grants been decreased? Is that the budget item that provides to those boards, Mr. Minister?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and that is not representative. That the community health boards receive their funding as grants through HPP, through health promotion and protection.
Honourable member for Gleithway.
Thank you, Mr. Chair. Thank you, Mr. Minister. Under the District Health Authority budgets, when you look at the DHA budgets, obviously the lion's share of the increases there is going into acute care. In fact, the increases total well over $71 million. Do those increases, Mr. Minister, allow the district health authorities to maintain the status quo, or are there some new programs that are being are new programs there in those budgeted amounts?
The Honourable the Minister of Health.
Cost, et cetera.
Thank you very much, Mr. Chair. The numbers for DHAs, for the most part, are based on their business plans as they bring them forward every year and their requirements. The number would be representative of contract negotiations and normal increases in operation, fuel charges, and those types of things. But also, there are a few new programs that would represent, and rather than try to dig out each one of those, I would also endeavor to have a listing for the member opposite. And as I'm reading some writing as we go, that things like mental health, primary health care, NSAHO pension, oncology increases, things like the switchboard for the Roseway, DHA2, the IMG clinic in District 2, wait time funding for DHA4. So there is a list of those, and I will endeavor to have those for you tomorrow.
Thank you. The honourable member for Gleithway.
Thank you, Mr. Chair. Mr. Minister, have any of the District Health Authority budgets been approved this year?
The Honourable the Minister of Health.
We cannot approve the District Health Authority business plans without the approval of this budget. So the answer is no.
Thank you. The honourable member for Glaceway.
Well, yeah, and I understand that, but you know, you would, I'd like to know when you anticipate approving these budgets. It's July, and we're 5 months into the fiscal year. And I'd like to know then, does it make sense, Mr. Minister, to you that the DHA budget should become part of the package that we debate here on the floor of the House?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And you know, each district health authority, as you see it here, are broken out for that very reason, to be able to discuss them and look at them. Of course, we have to wait till to the approval of the total budget before we can say a yay or a nay to any district health authority's budget. But I also want to comment for one of my opening comments is that, well, 2 points. One, that each district health authority knows that they pretty much can go and look at a 7% increase, as we have basically said to them year after year. We know that they have a tremendous challenge, whether it be wage or other issues. And the second point, to commend them for this year. They're coming in with at 1/20th of 1% of their total budget, and again want to congratulate them on that monumental effort.
The honourable member for Glaceway.
While we're on the subject of acute care budgets, Mr. Chair, it was announced today that surgical and obstetrical services at the Colchester Regional Hospital will be unavailable between July 7th and 10th, tomorrow, due to a lack of anesthesia coverage. Was the Minister aware of that specific cancellation?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And yes, I was aware of that, and the department continues to work with the Colchester Regional Health Authority to see if there's something we can do either on locum to provide those services to the Colchester Regional Hospital.
The Honourable the member for Glaceway.
Thank you, Mr. Chair. I'm sure the Minister will agree that this type of cancellation and the shortage in general of anesthesiologists has been a problem, that it certainly hasn't resolved itself. And I do recognize that the shortage of these specialists is not just a Nova Scotia problem, it is a nationwide problem. But I'm wondering if the Minister and the Department have developed a province-wide action plan that we can use to deal with this issue.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And some of the things that we have done as a strategy, of course, is to provide the best remuneration that we can. And we have come up with certain sharing arrangements in our alternate payment plans in order to correctly remunerate the anesthesiologists. And I can say to the member opposite that this tremendous issue across Canada, if not in all of North America. And things that I do want to look at over the next bit is trying to find some way to extend them, to if there's some collaborations that they can have with other health professionals to provide these anesthesia services to offer that to our patients. We're also looking at so anesthesiast assistants, and basically it's a I don't know if the professional would be a doctor or a nurse.
That would be a 2-year respirologist.
Or a 2-year respirologist, so they would
additional
have some kind of technologist training to be able to assist at different types of surgeries.
The Honourable the member for Glaceway.
Thank you, Mr. Chair. I might ask the Minister as well, while we're on the subject, have you had any discussion with your provincial counterparts regarding this problem? And if so, are there any unique programs or initiatives that are being undertaken by other provinces that perhaps would warrant looking into from a Nova Scotia perspective?
The Honourable the Minister of Health.
Yeah, thank you very much, Mr. Chair. And quite regularly, the people from the Department of Health, the deputy ministers, assistant deputy ministers, and and all those folks do meet often with their provincial counterparts, as well as I do with my counterparts, and have this discussion. And like I said, this is a national problem that we have, and it's something that we need to get our head around, because what's happening is jurisdictions are basically outbidding themselves for these types of professionals. And it's something that we've got to find a way to stop in order to make sure that we have the correct distribution across the country. And it's going to be very difficult to do that when you have such great remuneration programs like they do in places like Alberta. And but ultimately, we are leading Ontario in looking at our system and trying to have those extenders to try to find ways to offer better service and try to stop some of these closures, because ultimately it's not acceptable to the patients to cancel their surgeries, especially when some of them have waited so long to get them in the first place.
The Honourable the member for Glace Bay.
Thank you, Mr. Chair. The Minister, this is an area that ties in with the overall subject that we've been talking about today. The member for Sackville-Cobequid went on at great length about the fact that it ties into ER closures, wait times, the whole some of the big issues that are facing healthcare these days. But when we know that these problems are there, and we know they're national problems as well, we know that they exist, then what I'm asking, I guess, in general and perhaps even in detail, is what the Department of Health, what you and your department are doing to try and prepare for those problems, and how do we tackle them? And if you want to be as generalized as how do we tackle the problems of ER closures, but in this case in specific detail for anesthesiologists, again, this is not a new problem. And as I made reference in my opening remarks, you know, the whole issue here is one of sustainability. And if those problems exist out there, and they have existed for a period of time or years in this case, then what's being done, and what are the specific plans to try and tackle these problems?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite. We've been working over a number of years to prepare and to put certain actions in place with our wait times advisory committee, a committee that has provided us with a number of recommendations. Some of them revolve around certain information technology solutions, such as the NSHIS, to really make sure that we have the information that can flow from district to district. Also the PAC system, which allowed us to share diagnostic information from one district to another, so that the professionals required can see them, and to move on to things like OR scheduling programs, so that we can have a better feel for the ORs that are available, the professionals that can provide services in them, and allow our surgeons to travel maybe from one OR to another, so that they can provide services on a more regular basis.
The Honourable the member for Glace Bay.
I'm interested as well, Mr. Chair, in the Minister's comments when I was listening to his dialogue and debating the estimates with the member from Sackville-Cobequid. As always, the topic of private clinics will always come up in any conversation about health care, no matter what area of the country you live in, but in particular here in Nova Scotia recently. And I'm wondering where the minister stands exactly. I'm not saying that it was, I'm trying to be kind here, Mr. Minister. I'm not saying it was a wishy-washy kind of answer that you gave, but it wasn't really something that you could sink your teeth into. And I'm wondering where the minister stands in terms of, because you did indicate, I think anyway, you did indicate that private clinics do have some sort of role to play in healthcare in Nova Scotia. Am I correct in saying that?
The Honourable the Minister of Health.
Thank you very much. Thanks very much, Mr. Chair. And that's exactly not what I said at all. What I did say is that as we're looking at the total system, and this is not just a Nova Scotia issue. This is an issue right across the country. You know, do we take all options, and do we all look at them all? I mean, I'm not at a point where I want to take any option off the table. And if it requires analyzing certain public or privately administered programs, I'm not going to throw them off yet. But Mr. Chair, it is something that that Brian Postal, the report that just came out on wait times, addresses. It takes a glance at the public and private systems and to see if there's an integration of the two. But Mr. Chair, I have committed and will continue to commit that Nova Scotia and to my point, in Canada, will have a private or a publicly funded system. It's getting long in the day.
Thank you. The honourable member for Glace Bay.
Now, although the minister, Mr. Chair, would indicate that what I said was exactly not what he said is exactly not what I said at this point in time. What the minister is saying is that private clinics, private health care in this province is an option. That's what the minister's saying. If you're willing to take a look at it, that means you're willing to entertain private health care in Nova Scotia. You've as much as said that, Mr. Minister, that you'd be willing to take a look at it. So I think Nova Scotians have a right to know right now, and this is the time during any legislative debate, over the debate of estimates, that we get a chance to talk to ministers face to face and have them answer in detail exactly what's happening within their departments. So I'd be interested in knowing, and I'm sure a lot of other Nova Scotians would be interested in knowing, that is that what you're saying, that you're going to take a look at private health care in Nova Scotia as perhaps a means of providing health care to the residents of this province?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And quite honestly, as we look at wait times, as we look at the healthcare system in this country, I don't think it's fair to Canadians or Nova Scotians to take anything off the table as it stands today. So if there are options there that A, make it sustainable, and B, make sure that patients receive the care that they require, and C, is funded by you and me, the taxpayer, then I think it is incumbent upon us to look at all those options.
The Honourable the member for Glace Bay.
Well, Mr. Chair, exactly as estimates work and are designed to do, you ferret out the truth eventually. That's what estimates are all about. And the truth is here now that you have a government that's admitting through its health minister that they are willing to establish a private health care system in this province. That's exactly what the minister just said. The minister said anything is on the table and private health care is there as anything. So the private clinics that all the furor came up about over the last number of years, and all of the concerns that were there about queue jumping and about human resources going over to private clinics instead of being in the public health care system, the minister's now saying, well, that really doesn't matter. All the minister is saying is that if we have to look at private health care, we will, because that perhaps is a good way of spending tax dollars in this province. And is the minister going against just about everything that this country stands for in terms of public health care? Now the minister is saying that that's no longer the edict of this government, of this province, but you're looking at private health care now, and eventually Nova Scotians will be forced to pay for their health care, Mr. Minister?
The Honourable the Minister of Health.
Man, I think I should try to find a better way to explain this one because I think I'm going to continue doing it for the rest of the evening by the looks of it. What we're trying to explain is that we want a publicly defined system, a publicly funded system. If there are private issues in there to deliver the service, then I think it would be incumbent upon us to look at all those options. Ladies and gentlemen, Mr. Chair, I think as we look at the rise in cost of health care, the challenges in providing service, that I think it would be kind of silly not to throw things off the table. So I will continue to say we're looking at a publicly defined and a publicly funded system that all Nova Scotians can access health care. There might be some tweaks that we might have to do in the delivery system, and I know that I'm in peril of more questions on this one, but that's fine, because I feel and believe that in order to address the system and the change, we might have to change the system. And I'm not going to throw anything off the table at this point, but I am going to say once again, publicly defined, publicly funded. I'm not saying anything about private pay.
Consistent with the
Thank you. The Honourable member for Glace Bay.
Thank you, Mr. Speaker. And it's a great debate, Mr. Minister. It's one that is held across this province at many times. But when you say that you're not talking a private healthcare clinic, then you are talking about private healthcare clinics, because you're saying you'll look at anything. But what I think Nova Scotians would be looking at from you and from your government would be that they can have access, they can have public health care that'll be there guaranteed no matter what. And I don't get that. I don't draw that from what you're saying. What I draw from what you're saying right now is that you've got a system that's in dire straits. You've got a system that eats up more and more money every year, 8% this year. It's $2.8 billion, you know. Mr. Minister, you know how much, we all know how much of a drain that is on the public purse. We all know that it's approaching 50% of our budget, of our entire budget in this province. And we all know the challenges that exist there as well on a daily basis that face the healthcare system. But at the same time, Mr. Minister, don't stand in this House and say that you're not thinking about private healthcare. You are thinking about private healthcare, and you've just said it because you're prepared to take those questions, as you just said, and many more that will come based on that alone, that there's going to be some form of a private healthcare system in this province. Some form of a healthcare system that will deny those who can't afford it treatment, Mr. Minister. That's what I'm worried about, and I think that's what a lot of people are worried about in this province, whether or not they'll have access to health care in this province, and it won't cost them a cent, regardless of their income, that they will have access to public health care, Mr. Minister. That's a major worry of anybody in this province. And I'm looking for a guarantee from you right now, since we brought up the subject, a guarantee from you and your department that there will never be that kind of a system in Nova Scotia. There will never be a system where you have to pay to get treated in this province. That health care will be free and accessible to each and every Nova Scotian in this province from this day and thereon, Mr. Minister. Mr. Chair, I'd like that guarantee from the Minister today.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and I'm glad I had the opportunity to have this discussion because, let's put things on the table. And the opposition, it seems to be here and criticizing the growth in healthcare and the critical point that it's in and the problems that we're having, yet they seem to feel that you can't put anything on the table. So, Mr. Chair, I'm going to say that we're going to continue to be consistent with the Canada Health Act. We're going to consistent with publicly defined and publicly funded health care for all Nova Scotians, and I will commit to that. I can't commit to ever because I won't be here forever, but I will consider while I'm here that I will protect Nova Scotians, and I'll protect patients and everyone in Nova Scotia that I possibly can under a publicly funded system.
Thank you. The Honourable Member for Glace Bay.
Mr. Chair, Mr. Minister, you bring in private health care in this province. You won't be here forever. You won't be here much longer. I can guarantee you that, Mr. Minister. And you know that as well as I do, because you know what people think. You know what people say at the doorsteps during elections. You know what some of the main topics are, and you know that health care is always number one. It's always a number one concern of Nova Scotians, that people who wouldn't be able to afford treatment in that kind of a system get treatment in this country and in this province, Mr. Minister. You know that as well. You know that as well as I do. And Mr. Minister, Mr. Chair, you can shake your head all you want, but what you're talking about right now is introducing a two-tiered system in this province. One for people who can afford to pay it and one for people who can't. Now, Mr. Minister, you know that. You said that here today. I think that's an absolutely shameful statement, Mr. Speaker, an absolutely shameful statement.
The Honourable the Minister of Health.
Thank you, Mr. Chair. And it is funny how this discussion has sort of degenerated to the point of catcalls and accusations and those types of things. Mr. Chair, what I am saying here again, and I'll say it one more time, that we will have a publicly funded system for all Nova Scotians. So no matter who you are, where you live, what your educational background is, whatever it may be, you will have access to the health care that you need when you need it. How that is delivered, Mr. Chair, is the one that I say that we need to be looking at because of the cost and the escalation. So the member opposite can stand there and say, it's not sustainable to grow by 8% a year. It is not sustainable to continue to do it the way it does, yet he can't consider any options. How can you possibly do that, Mr. Chair?
Thank you. The honourable member for Glace Bay.
Well, Mr. Chair, it's not that we're not considering any options. The whole purpose of the last couple of hours that the minister has been questioned over the last 3 hours has been going over estimates and what you can do and different programs that can be provided to try and make the existing system better. That's our purpose, and that's always been our purpose here in this House, Mr. Minister. But what you've said, and you're not denying it, you said that you're willing to put anything on the table. Anything. And as long as you say that you're willing to put anything on the table, then I'll say again to you, you're willing to entertain any kind of system, which would include a two-tier system, which would include more private health clinics in this province. And as you said, it may be a different way of delivering it, but you can be guaranteed that Nova Scotians will be charged for that delivery. And that's where my argument is coming from, Mr. Minister. That's my argument, because I'll say to you that that's not the system that most Nova Scotians want, Mr. Minister, and I'll be quite glad to stay. Look, it's a great debate. I agree with you, but Mr. Minister, you said what you said. You said what you said, and what you said is that you're willing to entertain private health care in this province. You'll take a look at it, and Mr. Minister, you'll live or die by those words, okay? But they'll be there. They'll be there in the future, Mr. Minister. Mr. Chair, may I ask just how much time I have left, please?
The honourable member has approximately 2 minutes and a half.
Thank you very much. Let me ask. I have no reason to continue, Mr. Chair, but I'd like to give the minister an opportunity. I was going to ask before we got into that debate just exactly what his exact plan was, and I've asked for it already today and yesterday. And I'd like to know his exact plan, how he intends to deal with the problem that we have in this province over emergency room closures. What's going to be done about it? This is the summertime. This is when it occurs every year because of the doctors' shortage that occurs at this time of the year. And I'd like to know if the minister has an exact plan on how to tackle this problem, because it's a serious one. The minister knows that. I'd like to know what his department's going to do.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and thank the member opposite for that question. And it's quite a challenging one, and that, as he's well aware, as the professionals that are in our hospitals and provide service in our emergency rooms go off on vacation and do have families and people to attend to. So it is a challenge for us. But I can say to the member opposite that it is something that we want to continue to work with the doctors, because the doctors do hold a lot of the cards in this one, that we do want to continue to work with funding programs, that we do want to continue to work with them to find ways to find replacements. Again, we have one of the highest, or the second highest ratio of physicians and surgeons to population in all of Canada, and it is something that we should be able to address with some oversight. We need to know in the department when somebody is going off so that we can help provide and find some local service for them. But I'm not going to let this private healthcare thing go without the last comment there, is that we have a Canada Health Act that we must abide to. And it is an act that I believe in, and it is something that I believe as Canadians that we need to have Medicare, that we need to have a system that is available to all Canadians. And what I am saying is that as we look at service delivery within the system, there may be opportunities that I'm not willing to throw off the table just yet. We need to be looking at all options to make sure that we have the best possible health care for all Nova Scotians. But I will not be throwing out the Canada Health Act. I will not be throwing things out like that, but I will be looking at all options as they pertain under the Canada Health Act. Thank you, Mr. Chair.
The time allotted for debate on the estimates in Committee on Supply today has expired. The Honourable Government House Leader.
Yes, Mr. Chair, I would move that the committee do now rise and report progress.
Motion is carried.